I think it will be a bit of a tug of war. Tug of war because the promise is very high. AI as a technology and the analytics as a solution. One, we have seen multi-layer of solution in other therapeutic area. Cancer being an obvious example, cardiology being the next one, obesity, diabetes, any one of those areas. And within healthcare, neuroscience and neuropsychiatry really suffers from that. So the very first is mental health is not part of the coverage right now. Okay, it doesn't have parity. So parity is the very first challenge. Till it has parity, I don't think it is going to be anywhere at par with physical health. That's number one. We are less invested around anything of that nature, and we are truly invested. Almost success is only if the sector succeeds. Sector
Right.
succeeds only if the evidence problem gets solved. Our biggest risk is this sector not succeeding, and at that particular time, Holmusk will be substandard success. We truly have worked with every pharmaceutical companies to literally make this data useful for mostly their phase 4 studies and potentially for registry and phase 3 studies as we go along. Okay. This database has the potential to become quote unquote regulatory database for FDAs of the world and EMAs of the world. Okay.
Welcome to the Digital Health Transformers podcast, where we explore groundbreaking innovations shaping the future of healthcare. I'm your host, Greg, and today we're delving into the transformative role of AI in analytics in mental health. Joining us today is Nawal Roy, founder and CEO of Holmusk, a global digital health company revolutionizing mental and behavioral health through data and technology. Nawal brings over 15 years of experience in finance and strategy consulting to his mission of transforming mental health. Nawal, welcome to the show.
Thank you, Gregory. Thank you for having me. It's a pleasure to be with you.
Thank you so much. And Nawal, as I was saying before, I did a little bit of research on you, and you obviously have a very diverse background, rich in a lot of areas, but specifically in finance and consulting. I want to ask you, coming from that industry, what inspired you to transition into digital health and to focus on mental health through the founding of Holmusk?
Yes, thank you for asking. And I do get asked that question quite a lot because one, I'm trained as an economist. I've spent almost 15 to 20 years in finance, and I have seen the sector at a global scale. The single biggest factor that was obvious to me was the area that how finance has become extremely data driven. And I've seen that transformation happening. So it was more of a sector knowledge. And when I was starting this company or thinking about the something to do beyond finance or exploring into the idea of building something grounds up, healthcare was becoming extremely appealing to me. And the single biggest factor that was standing out that in healthcare, there is no real objective data that gets as the point of discussions for decision making. And that is where I started with the concept of everything related with chronic disease, and then layered that with the thinking that in any economy or a large sector, five or six major disease captures approximately around 70% of the cost. And if you double layer that and find out what is the biggest comorbidity that is driving the biggest factor, then you find that mental health is the largest problem that as of now, as a healthcare, as a sector is not solving. So it was starting with the data as a vision and how to really use data as an architecture for building a solution. And then on the back of it, going after the chronic disease and converging very fast towards mental health was the iteration for me to build.
Wow. I mean, that's like if I was gonna pick the most difficult piece within healthcare to go to, it seems like that's it, right?
That's
When
it.
you're talking about the brain and solving those issues. But you're right, it really touches on everything and it's largely been ignored
Yeah.
for a long time, even in this digital health transformation that healthcare is going through. So absolutely, makes sense. To
And that
ask
is why,
him,
if I may add, is the fact that I started this in 2015, 10 years back. Okay.
Right.
Uh, the access and a stigma issue was even much worse. I would say post-COVID, the word has become, accepted norm, but
Yes.
my intent is always to go after fields that becomes future ready down the stream, and that is why I went after it, even though it was not necessarily a hot topic to go after, you know. But I could see that the future will be ready for it. We can't ignore this problem, and that has only become far and far more evident now, and it's only rising up.
No, that's a definition of a trailblazer. It's a very scary space to go. Very
Mhm.
few people tackle it because of so many unknowns. And I want to thank you so much for diving deep. And I know it hasn't been easy in the last 10 years, but you seem to be taking the bull by the horn. So I would just want to thank you
Thank you.
from an outsider's point of view. As far as mental health care has long, as we're saying, it's long faced challenges in standardization and measurement. How do you see AI and analytics addressing these issues and transforming mental health care delivery? Noel.
I think it will be a bit of a tug of war. Tug of war because the promise is very high. AI as a technology and the analytics as a solution. One, we have seen multi-layer of solution in other therapeutic area. Cancer being an obvious example, cardiology being the next one, obesity, diabetes, any one of those areas. And within healthcare, neuroscience and neuropsychiatry really suffers from that. And hence, you will certainly have a very large, almost like a faith level thinking that someone will think around building a chat GPT for mental health. Okay. That need is obvious. Okay. But at the same time, every large, real, reliable AI or analytics platform is built on a quality database that can be used for foundational quote unquote training model. Okay. Because if you don't have a super solid foundational database, then you will have extremely high degree of white noise and hallucination. Okay.
Right.
Topics that anyone who is the credibility will get questioned if the technology could be right, but the outcome may not be anywhere legitimate from clinical point of view, and hence that can create the bifurcation between the expectation and what is the actual happening. But this will be a give and take, and that is what excites me a lot about Holmusk from that perspective. Because if
And
nothing,
I'm,
uh,
no, I'm
if,
sorry, go ahead.
if nothing, we have truly made the first scientific grade industrial scale foundational database for quote unquote a AI platform. There can be so much more that can be built on the back of it.
Yeah, and it sounds like Homos is really you're at the right space to make that kind of very specific platform, as you're saying. It
Yes.
makes sense, because a lot of industries are talking about going to very specific,
Mhm.
generative AI or LLM so that, they get less of the hallucination and the mistakes, as you said. So, oh wow, that's very interesting. So, what do you think are the biggest barriers in today's healthcare system to provide, in providing quality mental health care? And in that case, how can AI and digital tools help overcome them?
So the very first is mental health is not part of the coverage right now. Okay, it doesn't have parity. So parity is the very first challenge. Till it has parity, I don't think it is going to be anywhere at par with physical health. That's number one. For parity to really exist, uh, I think evidence is a larger problem. How do we truly answer that what the care delivery partners are delivering is only delivering the volume of the supply, or there is a effectiveness or the evidence of effectiveness? So I'm trying to not be science focused, but at the same time, I would like to draw attention to your audience is let me draw your attention towards evidence is a larger problem in mental health community. Until we solve the evidence problem, which is a semi-science problem to solve, we will have challenges fixing parity problem, coverage problem, access problem, stigma problem, and all of those factors. Okay.
So, you make a great point. So in that collecting evidence or having evidence, obviously Holmusk is doing that.
Yes.
And you're saying more companies need to do what you're doing.
Yes.
Is the reason why more people are not doing it because it's not the sexy, part of healthcare? There's still those kind of, people
It's a
that just
it's a circular vicious problem. Payers will pass the buck to, hey, the coverage is not there, so we don't need to cover. And we don't have coverage because we don't know what's the evidence. You know, the providers,
I
as
see.
of now, majority of them will say, okay, since the insurance is not covering or we don't know the rules, we are going to play by the way we are playing. So
Right.
everyone can pass the buck to next one. And as of now, the sector is in a vicious circle of who will crack, the code first, and where is the entry point, you know.
So in your estimation, who cracks that, and why would they want to crack that?
I would say it's in the best interest for both regulator as well as the payer to crack it. Okay. But if I were to really be outrageous, I will say it will not be cracked by existing member. It will be cracked by an outsider entrepreneur like us. Okay. We are less invested around anything of that nature, and we are truly invested. Almost success is only if the sector succeeds. Sector
Right.
succeeds only if the evidence problem gets solved. Our biggest risk is this sector not succeeding, and at that particular time, Holmusk will be substandard success. But if the sector succeeds and becomes even half of it close to cardiology or one third of, say, cancer, Holmusk will be a mega success.
Yeah, I hope that's coming. But I understand what you're saying by what you're saying by the challenges, and it's ever present. Interesting. Um, Next question, Nawal. I wanted to talk about AI and predictive analytics as it
Yes.
relates to mental health. So AI and predictive, excuse me, analytics are changing how we understand and treat mental health conditions.
Mhm.
How is Hallmarks utilizing data-driven insights to improve care delivery and patient outcomes?
Sure. So first of all, what we do is our biggest work is all around curation of the data. Curation of the data is a precondition for building anything industrial scale and scientific grade. So, with the highest of clinical and the science being the driver, we are the first company who have truly normalized raw data to a data that can be queried in a very serious way. Okay. And not to be geeky, but that curation is literally a massive science and technology problem. And we have done it with the highest of the order. And our proof of the pudding is not believing what I'm saying, but literally looking at the scientific publications. We have 70 plus peer reviewed plus scientific abstracts, total amount, around 20 peer reviewed and approximately around 50 plus scientific abstracts that we have published with the industry stakeholders. Even
Wow.
independent parties like Oxford and Stanford have used our data to publish. So that rigor and that scrutiny is very first condition on it. That's number one. Okay. Once you have done it, then we truly have worked with every pharmaceutical companies to literally make this data useful for mostly their phase 4 studies and potentially for registry and phase 3 studies as we go along. Okay. This database has the potential to become quote unquote regulatory database for FDAs of the world and EMAs of the world. Okay. On the provider side, we have been able to help large healthcare system, and it is mostly in UK with NHS, where our tools have been able to help the hospital system to stratify high risk patient. So how do you stratify high risk to medium risk and low risk patient? That risk stratification is very important to really improve the care delivery. Can it be extended at an individual patient level? 100% yes. Okay. But there comes the willingness of a partner who wants to go there and a commercial machinery that justifies that. As of now, in mental health, no one is incentivized to improve the care. No one. That architecture doesn't exist. Okay. And that is where I'm trying to figure out as to how the science of delivering it versus the economics 101 or the incentive to make that work. As and when that happens, if it happens tomorrow, trust me, we'll be the first party to go there.
Oh, it sounds it, and it's unfortunate because I can hear what you're saying. It's not like a space any other like retail or
Yeah.
gambling or anything where the ROI is obvious, right? Here the ROI isn't obvious, and that's where the struggle is ultimately. So it's
ROI is
creating
not
these
only
vicious.
obvious, ROI is non-existent. Okay, so
Yeah,
ROI on cancer is, if you make the delta, if you can save a patient by even reduce the mortality by even 0.1 basis point, all of a sudden that gets reflected in the cost of the care. Okay, both at an individual patient level, the impact is obvious on patient level and at a cohort level. Okay, but it doesn't exist in mental health.
I appreciate that. I'll definitely keep that in mind because that makes a lot more sense. There's no question. So, in this case, can you share an example of how a specific example of how predictive modeling or AI-driven insights have assisted healthcare providers in
Yeah,
making a better decision for
absolutely.
mental health patients?
I'll give you one of the prime example of a NHS hospital called Mercy Care in UK. They have approximately around 1,000 bed facility, and their key
Mhm.
task was given our front staff and limitations on their staffing, like every hospital system suffers that.
Right.
What they are looking for is how do I stratify who is my top 100 high risk patient or top 50 high risk patient so that I can manage and care for them different than others. Okay. We essentially took all their clinical data and converted them into a tool by which their clinicians and the front-end staff can use it on a continuous basis into their case management and care management. And all on a sudden, monitoring and doing it on a continuous basis has been able to reduce crisis event by approximately around 12%. There is a
Wow.
full independent study on it, and you can literally take that study objectively done by NHS, not funded by us, and and that study is a prime example of what is sheer potential behind this and what can be done. Okay.
That's amazing. And especially, so basically in these situations, these are things that they wouldn't have been able to see otherwise.
No, no.
And obviously this data helped them see things and kind of set things up so that they were ready. Wow, that's powerful.
And this we can
Um,
do for any large healthcare system. We can do for VA. We can do for we can do for jail system and all of those places where there is a high concentration of mental health patients.
yeah, that's and very wow. That when you said VA and the jail system, it really opened my eyes to. I wasn't even considering that
Yeah.
space. Wow.
Look at US. I mean, US has approximately 7,000 suicide among the VAs every year.
Yeah.
If can
Oh,
reduce 1% of that, it's a lifesaver,
it's a huge, huge, huge thing.
Exactly.
Wow. You kind of be up there. Telehealth and remote patient monitoring have expanded access to care. How
Yes.
is Holmusk integrating virtual care solutions into its mental health healthcare model?
So as of now, I mean, we are in discussion with multiple parties, and we are very keen to really go that path. We
Okay.
are directly not involved into the care delivery, and purposefully so that we can stay
Right.
extremely independent and do the work on the data point of view. But we would be very open to working with any hospital system or any remote monitoring platform, either through virtual or through a combination of virtual plus, insight to help them to leverage the data that we have. So we have approximately data of 35 million patients, and there is a lot of learning to be taken as to what works and how to reduce that trial and error in the care delivery. I personally think that anytime any one of these platforms want to go there and are incentivized to improve the care, then the historical database of 35 million people are going to be extremely useful and relevant.
I mean, when I hear you talking and explaining what Holmusk does, it almost sounds like if you have a system and you're treating these kind of patients, how are you not adopting a platform like this? Because
Yes. Yes.
what is what are you really doing? It's just kind of amazing the more and more we think about it. We talked. I was going to ask you a question about real world success story, but I think you gave me that with the 1,000 bed
Yeah.
facilities and but I want to ask beyond patient outcomes, how do these innovations assist healthcare providers and payers in creating more sustainable, scalable mental health care programs, if it can?
Yes. So I would say every healthcare system will tell you that only 5% of my patient pool has mental health and 20% of the cost is, attached to that 5%. Okay. That question is a question that every large insurer as well as ACOs and healthcare system is struggling with it. And it's impacting from the system point of view, it's impacting from quality metrics, and from payer point of view, it's impacting their cost curve. But both of them are not doing anything to find a solution.
I was afraid you were going to say that.
Okay? I'm sorry to be that blunt, but that is the reality right now. Now, they are absorbing the cost in 1,000 different ways, but a status quo is not the solution. Not doing anything is not the solution. And right now, it's a massive acceptance of the status quo and not making any change to do anything.
I want to ask you a question that's a little bit of an aside. Like back in 2008, there was the initiative by the United States government to kind
Yeah.
of push forward technology within healthcare and trying to deliver better outcomes. Do you feel like the government in some way, and not to get political or anything like that, but there should be some mandate that kind of gets a little bit more,
But
myopic as far as healthcare is concerned to push some of these initiatives forward?
absolutely, I can give you two precise examples on which if the rule changes tomorrow, everything will change. Number one is High Tech Act of 2009. 2009, 2011, government has given approximately around $37 billion subsidies from epics to Cerners of the world to really digitize metabolic health. Okay. And all of these companies have benefited from that, but behavioral health is not part of that. Okay. Do nothing, add mental health and behavioral health as part of that subsidy plan. All on a sudden, you will find that we have extremely large full convergence around truly knowing what is the coverage of digital health. Literally, you will have patients not on paper, pen and paper. You will have their coverage record on the digital platform. That's very basic.
Right.
Number two, Parity Act was written in 2008. Okay. You have almost 17 years passed by and it is not implemented yet. Make that
Wow.
make that real tomorrow. All of a sudden, US healthcare within 5 years, mental health will be as advanced as any other sector that you can believe within healthcare.
So essentially, the tools are in place.
Rules are in place
Someone just needs to turn the key, essentially,
and make it real. Make it real. Make it
make it
count.
real. Well, let's talk about the future of mental health and the technology. Looking
Yes.
ahead, Noel, what are the most exciting advancements you see in the future of AI and analytics in mental health care?
As of now, there is multiple that is happening. Number one, the sheer advantage that I see is it is no more a sideline sector, but it's a sector on which growth is happening on multiple front. Okay, so there are multiple small, whether it is care delivery platform, community platform, knowledge platform, all of those are rising. You certainly have esketamine from J&J as a drug that is on the rise. You certainly have BMS purchasing, Karuna that is on the rise. So the drug discovery itself is on the rise and it is becoming success. but all of these are neuropsychiatry. There is a larger amount of risk capital on the biotech side, both from the drug discovery side as well as care delivery side and caretaking side on the neurodegeneration side. So there is a literally Alzheimer's dementias of the world, and there is an extremely high correlation between things like cognitive impairment, cognition, which are related to both sides of the table. Okay. So as a sector, the sector is on rise for sure. And there is a more risk capital, there is a more innovation, and you are hearing at the second side, that how do we really enhance the capacity of the caretaker itself. So literally using audio technology, video technologies around so that we can capture better recognition and the risk factor and the evidence that, okay, this person is going up and down through the technologies, which is sentient technologies and all those things that can be in the background but can capture. Okay. All of those are certainly becoming a more and more reality, and you will see that emerging very, very fast. Okay. On the cutting edge side, you certainly have, the machine man interface and how it can truly change your neural circuit, and all of those is really happening. On the data side, certainly companies like Holmusk is, charting the way. I would say the very next one that you will see is how do we combine the data of Holmusk with a larger data set, which is on the metabolic side. So how do I combine diabetes plus depression data? Okay. And the amount of GLP success that you are seeing is certainly becoming very powerful. And as the compute of OpenAIs and all the AI companies become larger and larger, they will need always high quality data. And so the trend is converging towards CNS becoming a legitimate sector and not necessarily staying as a secondary point in the overall healthcare sector. Or at least that's my belief, and that is where I'm very partly biased, but partly also really extremely focused about it.
It makes sense, and I mean it's clear that as you said, Holmusk is positioning itself right there to be a part of that next wave, and I'm glad to hear that the future is bright. It's not all, it's not a negative thing, and it just is going to take a little bit more time than we probably want to, but the future is definitely bright based on what you said is coming up. So Noah,
Uh,
I just want to thank you. Oh, I'm sorry, were you going to say something?
no, I was saying that directionally it's extremely right field, and we are on the right side of the history, if I may say.
Yeah, I think so for sure. Wow, Noel, this has been an enlightening conversation. It's evident that AI and analytics are not just improving mental health care, but they're redefining how we understand and support mental well-being on a global scale. So I want to thank you again so much for giving us that insight, really opening my eyes to what's going on and letting us know about the future. And Hallmusk is clearly at the forefront. So thank you, and to our listeners, thank you for tuning in. Stay with us for more episodes where we bring you the innovators shaping the future of healthcare. See you next time on Digital Health Transformers. And that's
Thank you.
it. Noah, thank you so much. That was awesome. I really appreciate the insight. You really opened my eyes to some things I wasn't even considering. So I thank you for that.
No, thank you. Thank you for having me. And if I can be of any help, always a pleasure.
Absolutely. You have a great day. Thanks.
You too. Bye.